Live. I'm Ashley with 9 Health, and we're here we're on a quest to find where health happens. And so we're looking all over Colorado to find out where health is happening for you, because we know that health happens everywhere to everyone, whether it's good or bad. And today we're joined by Christina Schnacey. She is actually a leukemia survivor and the founder of Make It Happen USA. It's a nonprofit based here in Colorado that aims to educate people and to get more people on the bone marrow and stem cell registry. Is
Correct.
That right?
Yes.
So which means we're here talking about blood cancers as part of the Buddy Check 9 program here at 9 News. So thank you, Christina, for joining us.
Thank you for having us again. Appreciate it.
So, just to kind of get started, what is a blood cancer? What's considered a blood cancer?
So blood cancers, also referred to as hematologic cancers,
Okay.
are cancers that impact how your blood functions. And most of these cancers actually start in the bone marrow, but some of them actually can start in the lymphatic system.
Okay.
A lot of people refer to these cancers as leukemia, lymphoma, myeloma. Those are the common terms.
Yes.
Correct.
Okay. And is it true that every 3 minutes someone is diagnosed with a form of blood cancer?
Yes,
Is that
sadly.
true?
Yeah, it is.
That's too often. It's not
Sadly.
as rare as you think it would be.
No, actually, it's expected that this year 170,000 Americans will be diagnosed with a blood cancer. And actually, true story here, just last week, a friend of mine, I've known her for 12 years, was just diagnosed with Hodgkin's lymphoma.
Here in Colorado?
Here in Colorado.
Okay.
And here's another really sad statistic. Every 9 minutes, somebody passes from a blood cancer.
Blood cancer. Okay, so it's extremely common.
It's very common.
Very common. And you yourself are a survivor of leukemia.
Yes, I was diagnosed with leukemia 6/7 of 2010.
Okay. So you just had an anniversary.
Yes.
By the way. Do you?
Yep, 7 years.
7 years. Wow.
7
Okay.
years.
I want to share this video off on your page too, so that's why I'm looking a little distracted here. But tell us about, so you are a survivor. Tell us about what you were experiencing as it was leading up to your diagnosis.
So for 8 months, we went through different medical professionals looking for answers, because there were so many symptoms associated. And a lot of these symptoms actually are attached to other illnesses.
Sure.
So the symptoms that I had were extreme fatigue. And we're not talking just about, I'm a little bit tired. It's literally bone-crushing fatigue where you feel like you've got to sit down or lay down.
Oh, you're going to pass out.
Or you're going to pass out.
Okay.
Then another one that I had was nausea. I had night sweats. I had headaches.
Interesting. Okay,
Yeah.
and consistently over the span of a couple of weeks, a couple of months.
Over about 8 months, yes.
8 months.
And
Wow.
I lost a lot of weight. I lost 15 pounds.
Really? And it was very noticeable, so you knew something was wrong.
We knew something was wrong when I wasn't feeling like myself. And as you may or may not know, I'm very health conscious. So I knew what my stats were. I knew where my body was. I knew everything about how my body feels on a day-to-day basis. And it just didn't feel right.
You knew something was wrong.
I knew something was wrong.
Okay. And so when you were finally diagnosed, you were able to get into treatment, or tell us a little bit about your treatment journey.
So once you are diagnosed by your physician, obviously it's up to them, to your doctor, to decide what your route is going to be. But the normal standard practice is chemotherapy and radiation. So once you're diagnosed with a blood cancer, most doctors are going to go with chemotherapy and radiation. At some point, they're going to run additional tests. If there's any sort of inversion in your blood cancer, or if it's just persistent and it's not going away, they're going to recommend a bone marrow transplant.
Okay. And that sounds scary. That sounds invasive, right?
It sounds scary, yes. If you're the donor, it must sound very scary that I want you to donate your bone marrow to me, but things have changed, and actually most of the time we're not asking you for bone marrow.
Okay.
Very, very interesting. So a lot of people still think that we're looking for bone marrow, and 90% of the time we're actually not. We're actually looking for you to donate your blood stem cells.
And that's an important piece that I really want to talk about today here with you, among so many other things. But, part of your work with Make It Happen is to get people to register to be a bone marrow donor.
Correct.
And I think a lot of people are nervous because they think it's such an invasive procedure or it's so scary, but that's not the case anymore.
Nope, it's not the case.
So signing up to be on the bone marrow stem cell donor registry is not guaranteeing that you're going to get some, have that invasive procedure. You're saying 90%.
No, not at all.
Of transplants or recipients, it's more like giving blood. Is that what it's
Absolutely correct. So the only time that a physician will ask for bone marrow, if it's a very critically ill patient or a child 10 years and younger. And the reason that you will be asked for bone marrow for those is a body will assimilate the bone marrow quicker.
Okay.
So the other 90% of the time, we're just going to ask you for your blood stem cells.
Okay.
And it literally is as easy as hooking you up to a machine. We're taking your blood out. We spin the machine, or the blood through the machine. We pull out all of your blood stem cells. We give you all of your blood products back.
Oh, okay.
And that's it. Now, the process is longer. It takes about 4 to 8 hours, depending on your veins.
Okay.
And there is some preconditioning that has to be done the week before. But other than that, it's literally as easy as donating blood.
That's fascinating. And so it's not as scary as people might think it is.
No, it's actually scary for the patient because on my side as the patient, I have to go through chemotherapy and full body radiation to prepare me for the transplant because we want to kill off my bone marrow. So when you're doing the preconditioning on your side, which is a medication called Neupogen, and it's just a medication that's given to you once a day that allows your bone marrow to make more stem cells because we need a lot of stem cells in order to do the transplant. So once a day for 4 days, you get a Neupogen shot that is actually for me. The last one's for you because on that 5th day, we're going to take your blood stem cells away from you. So we want you to have some blood stem cell production right after. And so you're going through the shots. I'm going through full body chemo and radiation. Then on the 5th day, you go into a collection center, and what we do is we hook you up, both arms. We take the blood out from one side, spin it through the machine, take the only thing we need, which is your blood stem cells, and we give you all of your blood products back through the other arm. Perfect. And you're sitting in this comfortable chair. I mean, you're being catered to, whatever you want to eat.
You're saving a life.
And you're saving a
Can't
life.
forget that piece.
Well, and and I always say this, you're not just saving a life, you're actually saving a family.
Absolutely.
And you're saving a community, because there is a community of people that surrounds that patient. So you're not just saving a life, you're saving a family.
Absolutely. You're so right. I love that perspective. I love that perspective. And if you're just joining us, we're here with Christina Schnase. She's a leukemia survivor and also the founder of Make It Happen USA, which is a nonprofit here in Colorado that aims to get more people on the bone marrow and stem cell registry. So if you have any questions about blood cancer, about being proactive about your health, or about becoming a donor, or joining the registry, we'd love to chat with you. So ask your questions here in the comments. But Christina, tell us about the process to become someone on the registry. That's even easier.
It's
isn't it?
way easy. So a lot of people think I'm going to take blood. I'm not going to stick you with a needle, nothing. It's, the swab sticks?
Yes.
All we do is we have you fill out a one-page form.
Okay.
We give you 2 swab sticks that we just hand them to you. You grab them yourself. You swab the inside of your mouth. Then we put them in an envelope. We seal the envelope and we ship that off.
That's it.
That's it.
It's like less than eating a sucker.
It's
even
yes.
quicker. It's even quicker.
It takes 3 minutes to get you on the registry, literally.
Okay.
3 minutes to get you on the registry. We will answer all of your questions that you have. If you've got a medical condition, we've got a wonderful reference book that we can look at to see whether you do or don't qualify to even be on the registry. A lot of times we might even just swab you and hand that in, but we will put on the envelope, she mentioned she has this disease.
Sure.
And then that way the medical professionals with our partner, Delete Blood Cancer, will call you and they will say, hey, unfortunately, because of ABC, you don't qualify, or don't worry about it, you're actually fine.
Oh, okay, great.
And actually, even pregnant women, we have a lot of pregnant women that do sign up and get
Yeah.
on the registry.
Because you're not going to be pregnant forever.
You're not going to be pregnant forever. And of course, while you're breastfeeding and while you are pregnant, we do not ask that you be part of it, but we take you off the registry. Okay. So we ask any female that does sign up, if you do happen to get pregnant, please call us.
Okay,
There's
a good reminder.
Yes, there's an 800 number on the back of the card. Please call us. Give us your registration number because you're just assigned a number. You're not assigned a name, just a number.
Okay.
And then we'll take you off the registry while you're going through the pregnancy process because we don't want you to match somebody while you're pregnant.
That's a good reminder. I need to do that because I think I'm on the I'm on it for Be the Match.
Yes, another partner,
And okay, I need to do that. Note to self.
Note to self. Make sure you take yourself on the registry.
I need to take care of that. Okay, so tell us a little bit more about. So you talked about the symptoms you were experiencing when you were first diagnosed, and we talked about that at the beginning. But let's talk about that again, just in case anyone new is joining us here on this conversation. So the symptoms that you were experiencing as you were realizing that maybe something was wrong with you.
The first symptom was just a fatigue. Okay. It was a bone crushing, just an amazing, it's not I'm tired, I didn't get enough sleep fatigue. It's just this fatigue that makes you feel like if you don't sit down, you're going to pass out.
Okay.
So that was the biggest one I had. And then shortness of breath. I couldn't go up a flight of stairs without having to stop halfway up the stairs.
And that wasn't normal for you.
And that was not normal for me.
You were used to being able to just
I was active.
Right up.
Yes, I was active. Let's say I could be on the Stairmaster for 45 minutes and not have a problem, but then all of a sudden I couldn't go up a flight of stairs. There was a problem. Headaches. I had very frequent headaches. And it wasn't because I wasn't drinking enough water. Again, we know our bodies. We know how much water we need on a daily basis. So it wasn't from that. It wasn't from stress. And then the other part is just the nausea and the night sweats. I didn't feel good. I started losing a lot of weight. I couldn't keep food down. And I would have these night sweats. Literally, the bed would be soaked.
So not normal.
Not normal.
Not what you were used to. And
No.
when you started to realize something might be wrong, you made an appointment with your doctor. That's
I made an appointment with my general practitioner,
Okay.
and he kind of looked at the symptoms. And at the time, actually, I also had systemic lupus. So, unfortunately for me, everybody starts to blame it on the lupus. So we went to my doctor that was dealing, my rheumatologist. We worked with her. She didn't think it was the lupus, so then I was sent to an internist. Then I was sent to a cardiologist. And so different doctors got involved. And actually, I did appreciate that about the medical community, is that my doctor really was my coordinator, and he made sure that every other doctor was touching me so that we didn't miss a symptom that could have been like a heart condition or a neurological condition. So I really appreciated that about my physician.
Absolutely.
And after 8 months, unfortunately, it took that long, but
Wow.
after 8 months, what happened is the cancer, the blast, actually broke out of my bone marrow and started circulating through my bloodstream. So that's how we discovered what I had. It wasn't because of a medical test. It was actually because the blast broke out.
Became so powerful.
It broke out of my bone marrow. It was circulating, landing on all my organs.
Wow. But look, and she's here to smile about
I'm
it. And
here to
she's
smile about
here
it.
to say, look what I've been through, but I'm still here.
I had an hour to get to the hospital to start chemo.
Oh my goodness.
Yeah.
Just in time. Now we talk about there's populations, not so much that are more at risk for blood cancer, or are there populations that might be more prone to this type of cancer?
Unfortunately, scientists don't have a specific risk factor that causes any cancer, really. But there are some things that have been identified that do relate to cancers. For example, if you landscape and you work a lot with a lot of the, I don't want to name, benzene.
Different chemicals.
Different chemicals, correct. Benzene has been linked to Hodgkin's lymphoma, actually. It's a big thing going on right now. There's another thing, radiation, of course. You know, if you're next to an atomic bomb or work with any of those products, you're at a higher risk. And then there's extreme exposure to low-level radiation, and that's caused by power lines. And there's a lot of studies that are coming out right now that extreme exposure to those electromagnetic fields can lead to some of these cancers.
Okay, interesting.
So there's a lot of studies out there. Scientists are still obviously looking for all the risk factors, but as far as a population, there's not one specific area in town that we can link to a cancer.
Absolutely. So if you're just joining us, we're here with Christina Shanasi. She is a leukemia survivor, and we're talking about different types of blood cancers as part of our Buddy Check 9 program for the month of July. So then, Christina, tell us a little bit more about, like, if you have any recommendations on being proactive, or is there a way to screen yourself at home for this type of cancer, or just it's more of like a heightened sense of awareness, it sounds like?
Know your body. If I can give anybody an advice, know your body, please. Know what your red blood cell count is. What's normal for you? Know what your blood pressure is. For example, I run low. I have low blood pressure. So whenever I go see a new doctor, the first thing they look at me and go, are you okay? Are you dizzy? Well, no. I know it's just I run low.
Yes.
What is your normal red blood cell, white blood cell count? Even simple things like how much water does it take for you on a daily basis? How much water do you have to drink so you don't get headaches?
To feel hydrated.
Right. Know your body and actually start really documenting if you start to feel anything that's off, whether it's a headache, whether it's night sweats, whatever little symptoms you're having, contact your medical professional. Go in and see your doctor and just say, I don't feel good, doc. Here are some of the symptoms that I'm having. Your medical professional will actually appreciate that you're documenting these things for them, because it gives them a roadmap of what might be happening to you.
Absolutely. And you mentioned your red blood cell counts, and you can actually get your blood cell count taken care of at 9 Health Fair. We have a low-cost screening to give you that overall picture of your health. It's called our blood cell count screening. We actually have fairs coming up this fall, so if you're interested in getting that kind of baseline level determined or established, we'd love for you to come out to one of our fairs this fall and get that checked out. Also, you can get your blood pressure for free, lots of other good free screenings. So we'll be posting our list of locations in early August, so check back then. And Christina, you've actually been a part of a lot of our fairs with Make It Happen USA, which is where you've gotten some of your donor registries, right? We even had some matches.
We've had some matches, yeah. We've had
through 9 Health Fair participants.
Through the 9 Health Fair programs, yeah. The partnership we've had with 9 Health Fair is amazing because you impact so many different communities, and that's exactly what we want to do. A lot of people don't realize this, but a lot of the ethnically diverse populations have the lowest registration numbers.
Yes.
So if you do get on the registry, the only time you would be called to actually donate was if you do match somebody. That's what everybody needs to know, is you're only called upon if you match somebody. But the other thing that I really want to educate the different communities on is if you're Caucasian, it's a 1 in a million chance that you'll be asked to donate. But if you're African American, Hispanic, it's like 1 in 10 million, I think is what the last number was, because the registration has 10% or less of our ethnically diverse populations.
Okay. So it's important to get lots of a variety of different populations on that so
Yes.
that there can be better chances of matches.
Correct.
Okay.
14,000 patients are looking a day for a donor match.
14,000. Wow.
14,000 patients a day are looking for a donor match.
And by becoming a registrant, or is that what you call them?
A registrant, yeah.
But by joining that donor match, you become a part of the national database. Is that right?
Correct.
Okay. So
It's
you
not just
could
a local,
be-
it's
Not
national.
just Colorado. You could be matched with someone far away.
Correct.
And actually, in your experience, you were matched with someone. Where was your match found?
Boston.
Boston.
So my family, no one matched me, not my kids, which we knew my kids would not match me. My son, however, matched a woman in California, and he donated his stem cells to
Oh
her
my
and saved her
goodness.
life.
Oh my goodness.
So it's a little circle here. So my son donated his stem cells and saved her life. My donor was found in Boston.
Okay.
She had literally just registered. Her college campus was having a donor drive. 4 weeks earlier, she had registered, and she was a perfect
Wow.
10 out of 10 match for me. And we had been looking for about 4 months.
Wow. And that sounds, 4 months, is that kind of quick?
Very quick, actually.
Okay.
It's very quick. And considering that I'm half Hispanic, the chances of me actually finding a donor were very rare.
Wow.
So-
across the country.
And across the country in Boston, this wonderful 20-year-old signed up, and she matched me. When she was called, she sat down with her parents and told them, hey, I'm actually a match. Delete blood cancer is wonderful. They sent out a representative. They asked so many questions of the representative. They answered all of the questions, and as a family, they decided to go ahead and let Diane proceed and donate those stem cells to me.
That's so cool. And there's a video on the website, right?
Correct.
On the Make It Happen website of you two meeting for the first time?
Correct.
Is that right?
Yep.
Okay. And you meet after the process.
Correct. 2 years after the process.
Wow. So if you want to have a heartfelt moment, check out Make It Happen USA's website. You can see Christina meeting her donor match.
And I've flown out to Boston. I've met her family, had a wonderful party out there. We flew her out here. We had a
She's
party
a
out
part
here.
of your family now.
She actually has a room in our house, and everyone refers to the room as Diane's room. So
Diane's room.
no one goes into Diane's room.
That is so cool. And tell us again, for anyone that might just be joining us, when we think of bone marrow transplants, or if you think about being matched, you kind of think about a very invasive procedure that might be scary or might be overwhelming and might deter you from joining the registry, but it's actually not the case anymore.
No, it's as easy as donating blood. It really is. It just takes a little bit longer, but it's as easy as donating blood.
It's just taking blood out, taking what you need, and then putting it back in.
Correct. All we're keeping are your blood stem cells. We're giving you all of your blood product back.
And if you wanted to become or join the registry, how could someone do that today?
Well, you can call us, or you can send us an email. You can send us even a link on our website. You can call us at 303-667-6657. We'd be happy to send you the kit. If you are not in the Colorado area, you can also go to deletebloodcancer.com, and you can sign up for the kit, and they'll mail it to your house.
Oh, really?
Yep.
Is it free?
Yep, it's free.
Really?
Yep.
Okay. So it's pretty easy to do it, and you can also find a lot of your representatives at local events here.
Correct.
Just kind of sporadically.
Yes, so that's one of the partnerships. We love the partnership with Nine Health First because we do get to go into the different communities and we get to swap people. We've had several matches from the Nine Health Fairs, but we also have partnerships with a lot of our local businesses that we do these donor drives at their place of business.
I love that. That's the thing about it. It is so easy. You just have to make it even easier.
Correct.
For people to become part of this donor registration. So tell me, you gave me some really great information about the community. How can the community help against the fight against blood cancers? And I love what you shared with me. You had kind of like these 5 points. Do you remember?
Yeah. Well, first,
Tell
know
us
your
more about
numbers.
that. Okay.
Know
yes.
your numbers. Just be proactive with your own health and know your numbers. That's always essential to any of us, I think. It's just easy for everybody to do that. Second, help us educate the communities. So we all have community centers, places of worship, or even our jobs where a lot of these events or a lot of these community events want to have an event where we can either educate or do the donor drive. So bring us in. If they just want to ask us a whole bunch of questions, we can definitely do that. The third thing you can do is help us schedule that donor drive. If you enjoy what we said at the education drive, come on in, volunteer with us, and let us do that donor drive at your community center. We love doing those. Another thing you can do is if you don't feel comfortable with any of that process, donate blood and platelets.
Okay.
Essential for any blood cancer patient coming out of a bone marrow transplant or even going through the process of chemotherapy and radiation. Blood products are essential, whether it's red blood cells or platelets. So please contact Bonfils, donate blood, and you can also contact local hospitals. A lot of the local hospitals actually have centers, infusion centers, where they will collect the blood.
Wow. Okay.
So that's very important. Number 4, if none of this really works for you and you kind of don't feel comfortable, hey, we can always use more volunteers.
Absolutely.
Come and volunteer with us. None of us get paid. Everybody at Make It Happen USA is 100% volunteer. We all have full-time jobs and we volunteer our time. And lastly, if you don't have time to volunteer, donate some money.
Always donate money.
Donate money. There's expenses that we have to cover as an organization, not salaries, but expenses related to the swabbing, the kits, or even the travel that we have to do. We've actually started as just a little local Colorado company, and we've gone into 7 states now.
Wow.
So we're in California, we're in New Mexico, we're in Arizona.
That's incredible. Well, thank you so much for joining us today, Christina. And we're going to sign off here, but thank you so much for joining us. If you have any questions about blood cancer or want more information, you can post something here in the comments and we'll respond to you, or check out Make It Happen USA's website or Facebook page. Lots of great information there.
Correct.
Thanks for joining us and have a great day.